Hey guys, welcome back to the channel. Hope you guys are doing good. This is part 2 of the video on cell injury and its pathology. So without wasting any more time, let's get started. In previous part of the video, we discussed about the classification of cell injury, which included reversible and irreversible cell injury. In this video, we will discuss the step after irreversible cell injury, that is cell death. Cell death occurs either by necrosis or by apoptosis. For this video, we will concentrate on necrosis. Starting with the first question, what is necrosis? It is defined as pathological cell death and is associated with inflammation. There are various types of necrosis, which include coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, fibrinoid necrosis, and gangrene. We will discuss about them one by one, starting with coagulative necrosis. This is the most common type of necrosis. It occurs in solid organs like kidneys, liver, and heart, but not in brain and pancreas, and we will see why they are not included later in the video. The mechanism of action of coagulative necrosis is denaturation of proteins. Let's have a look. So figure 1 demonstrates coagulative necrosis in the kidney. This area outlined in yellow is the area of infarct, which is generally wedge-shaped. The second figure demonstrates the histological slide. We can divide this image into two parts through this black line. Here you can see the normal histology of cells with every cell having a normal nucleus. On the other hand, here you can see these cells having pink colored outline without any proper visible details. These cells are called as ghost cells. And this pattern of many ghost cells is called as tombstone appearance. Another type of coagulative necrosis is known as Zenker's degeneration, though it is not a frequently asked question. Zenker's degeneration occurs in typhoid fever. It is a complication seen in skeletal muscles of the rectus abdominis muscle and the diaphragmatic muscle. Next type of necrosis is liquefactive necrosis, also known as coagulative necrosis. Remember, here we discussed about the exceptions of coagulative necrosis that were brain and pancreas. These organs are included here in liquefactive necrosis because they are rich in hydrolytic enzymes. Liquefactive necrosis is characterized by complete digestion of dead cells by enzymes, and thus the necrotic area is eventually liquefied. As it says, the area of the organ will be liquefied. This means the tissue architecture is not preserved here. And this makes it different from coagulative necrosis, because the tissue architecture in coagulative necrosis is preserved. Another example of liquefactive necrosis are the abscesses. Let's have a look. This figure demonstrates complete digestion of dead cells by enzymes, and thus the necrotic area is eventually liquefied. This is the histology slide of liquefactive necrosis. As you can see here in the middle, this area is pinker with more space and fewer neurons. This is the cross section of the lung. There is confluent bronchopneumonia complicated by abscess formation, which is seen here as a cystic cavity. This is the example of abscess which we discussed here. Third type of necrosis is caseous necrosis. Basically, caseous necrosis is coagulative necrosis combined with liquefactive necrosis. The examples include tuberculosis, fungal infections like histoplasmosis, coccidioidomycosis, and syphilis. This is a tuberculous lung with a large area of caseous necrosis containing yellow-white cheesy debris. In caseous necrosis, there is cheese-like appearance of the organs. Fourth type of necrosis is fat necrosis. It occurs in fat-rich organs, for example breasts and omentum. The mechanism of this necrosis includes breakdown of fats into fatty acids. These fatty acids combine with calcium to give chalky white appearance. Another commonly seen example of fat necrosis is pancreatitis. Let's have a look. So these are the pancreas of a patient who died of acute pancreatitis. And as you can see here, this is fat necrosis. These small white areas are the fatty acids and calciums combined, giving it a chalky white appearance. Here are some remaining steatocytes at the left which are not necrotic, marked by green star. On the right, necrotic fat cells have vague cellular outlines, having lost their peripheral nuclei, and their cytoplasm has become a pink amorphous mass of necrotic material, marked by a yellow star. Next, we have fibrinoid necrosis. This type of necrosis is associated with antigen-antibody reactions, that is, immune complex depositions. Examples of diseases include polyarteritis nodosa, a serious inflammatory blood vessel disease, rheumatic heart disease, that is, a systemic immune condition that occurs as a complication of rheumatic fever, systemic lupus erythematosus, a diffuse systemic disease of connective tissue, and malignant hypertension. Let's have a look at an example. So this is a slide of a blood vessel. And this marked area here is a bright ring of fibrinoid necrosis. Any guesses what this disease could be? Yes, you are correct. It is polyarteritis nodosa. Last type of necrosis is gangrene, which is diagnosed by a clinician. Gangrenous necrosis generally describes the damage that has occurred to the extremities, especially lower, where there is severe ischemia. These extremities lack in blood supply and oxygen and typically cause coagulative necrosis at different tissue planes. This is known as dry gangrene. If bacterial infection occurred, liquefactive necrosis could also be occurring due to the degrading enzymes and the involvement of leukocytes. This is known as wet gangrene. A simple trick to remember these is when there is coagulative necrosis involved, it is dry gangrene. But when liquefactive necrosis is involved, it is wet gangrene. Let's have a look. This is gangrene or necrosis of many tissues in a body part. In this case, the toes were involved in a frostbite injury. This is an example of dry gangrene, in which there is mainly coagulative necrosis. This is gangrene of the lower extremity. In this case, the term wet gangrene is more applicable because of the liquefactive component. With this, we wrap up all the types of necrosis. So that is it for this video, guys. Don't forget to subscribe the channel and follow us on Instagram. Links in the description.